So let's talk about this skills gap. This is a survey I did last year, fairly small survey, but surprisingly consistent with other surveys. Notice nobody found things very easy. This wasn't just healthcare, but this was CISOs across multiple sectors, and about 83% said it was either very difficult or moderately difficult. And this gap is undermining security. I have to take my hat off to Intel Security. They were the first, I think, to do a survey where they actually asked about this impact. So in that survey, this was done late last year, I think, 82% of people admitted to a shortage of cybersecurity skills. This was IT people in 7 different countries, but it was a sample of about 700, so it was pretty broad. Admitted to a shortage of cybersecurity professionals, and then 71% cited that shortage as being responsible for direct and measurable damage to organizations. And commenting on the report, James Lewis, an expert I respect a lot, said a shortage of people with cybersecurity skills results in direct damage to companies, including the loss of proprietary data and intellectual property. So it's not just, oh, this is really hard to hire people. This is hard to hire people. Gaps are unfilled or underfilled, and we can't do our job. And it's clearly hurting healthcare. So if we assume 4 out of 5 organizations are finding it hard to hire, and the demands of the job in healthcare are above average, and some healthcare job locations are not universally appealing, that is, you can't move your healthcare security, I don't think, to a place where security geeks typically hang out. You know, the Beltway, for example. Now, if you're doing healthcare at a hospital in Tennessee, you need to bring security people to your hospital in Tennessee, which is a lovely place, and I have friends who live there. But this is something that healthcare CISOs brought up to me: is, you know, if you're in a rural location, it's not necessarily you don't necessarily have a big pool of cybersecurity people locally to draw from. And I think that experience of direct and measurable damage that Jim Lewis refers to is probably going to exceed the 71% if we measure this, which I'd like to do at some point later in this year in the healthcare space. So what's being done to address this gap? I don't want to just raise a problem and throw it out there and say, oh, you know, it's terrible and we're all struggling. There has been a lot of work done, and I'm not going to go into great detail in the next few slides, but they're there for you to research. The National Initiative on Cybersecurity Education is, to my mind, a piece of the federal government that's worked very well. It's done a lot of good work in forming a better understanding of what it takes to do cybersecurity jobs and what the jobs in cybersecurity are. It's been behind a push for more degrees, apprenticeships, and other recruiting methods in cybersecurity, and indicating the need to recruit more women and minorities, or recruit from women and minorities, because they are undertapped in terms of cybersecurity potential. And there's just kind of a workflow there. I would definitely check out NICE online, and I'll show you where to do that in just a moment. So the NICE work has been sort of pulled together at something called cyberseek.org. I urge you to go there. It uses what NCWF is the National Cyber Workforce Framework, and it's the standardized taxonomy of knowledge, skills, and ability in cyber. So that if you say to HR, we need to hire a network security person, cyberseek.org and the information there and this taxonomy can really help you define the job, what is needed for it, what is it being paid for that job in different parts of the country, and so on. And in fact, you know, a lot of HR departments want to know about the career pathway that's available for different jobs, and that is all mapped out at cyberseek.org. This is also at cyberseek.org. It's a heat map of supply and demand. I just mentioned the number in the lower left-hand corner. The total cybersecurity job openings. Now that's over a 12-month period, but it's 348,000. And that's, getting on for half of the workforce job vacancy during a year. It's clearly a very tight market for people in cybersecurity. Just mention this, NICE, if you're interested in the work that NICE is doing, the NICE conference, which is in November, this year it's in Ohio, a great place to go and meet with people who are working on solving the skills gap for their organization. And there are certainly plenty of people there from the healthcare industry sharing tips and tricks on how to address this.